Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and thanks for tuning in. If you follow our channel, you know that I do cosmetic facial surgery in Richmond, Virginia, and I only do surgery from here to here. I don't do boobs, bellies, and butts, and facelifts are my favorite procedure. So we've done over 1,300 facelifts. At this point, I work 4 days a week, and I'm usually doing a facelift every day. We did 110 facelifts last year, and again, I am passionate about this, and it's my life work. So I have so many videos out there on facelift and what we do and how we do in facelift recovery and you name it. I've got a lot of videos on YouTube about facelifts. So one of the questions I get frequently are, hey, Dr. Joe, you have all these thousands of pictures, before and after pictures on your website. So yes, we can see what people look like later, but what do they look like up front? How bad's the recovery? Is it painful? Am I swollen? Am I bleeding? Am I black and blue? So what we did here, we're going to follow a handful of patients, and I'm going to show you what they look like the day after surgery. Some of them may be several days after that and maybe a week after that, but most of them are the first day out of surgery. So the purpose here is to show you what people look like. Now, the bell curve of recovery for anything you do, you have your average people that are in the middle. So most of our patients take 2 weeks off of work, and most of them are ready to go back to work or play. You have some people that heal a lot quicker. You have some people that take a little longer. Most of our people do really well, and they're pretty surprised how easy the recovery was for a facelift. And I'm not trying to sugarcoat that when I say easy, but it wasn't as bad as they expected. And every once in a while we have somebody, it's just harder on them. But you'll see some common denominators that have to do with attitude and other factors that I think make the people that we're showing look good. Now, I didn't just say, let's just take the people that did well. These patients were all seen back to back. Well, we were over this last, 5 or 6 days. So they're sequential patients. So join me in watching this video, and I'm just so honored to have your time. I'm Dr. Joe Niamtu, LoveThatFace.com. So here we are in our little series of post-surgery interviews, and again, one of our favorite patients, and she is 24 hours after comprehensive facelift with platysmoplasty and smastectomy, bilateral cheek implants, bilateral upper eyelid blepharoplasty, and perioral and periorbital laser. So this was probably about a 2.5 hour procedure, and again, we just did it 24 hours ago. So tell us a little bit about how's your last day been?
Well, I am feeling much better today than I would have anticipated. Yesterday on the ride home, my best friend was a wet, cool cloth, and that was my best friend throughout the night. And thank you to my husband for being such a good caregiver on that, because that was the most painful part for me, was feeling that.
Now you're talking about the laser?
Yeah, it was the laser. So I just had the wet, cool cloth on, and that was so good. That was so refreshing. Surgical pain, I would have anticipated that. It was not any worse than I would have even imagined. It was just typical post-surgical pain that one would expect. How do I feel today? I can feel that my skin is tight. That's to be expected. I'm not looking at myself in the mirror much, but I hear that you guys think that I look good for 24 hours post, so I believe you because you're the pros. I feel pretty good, actually.
Well, good.
Honestly.
Well, she was uncomfortable when she left yesterday, and that's not uncommon. And we're not going to sugarcoat this. You have this much surgery, you're going to have some discomfort, but attitude is so important, and she's got a great attitude. She's a fun person. We have a good time, but she's a smiler and an upbeat person. And again, I want to stress the fact that for some patients it's easier, and some patients have a harder time with it. So what we're going to do is come back here in a second, and we're going to look at her incisions. All right, so I want you to notice this patient has a beautiful, almost a right angle neck here. We've really tightened that skin nicely, and I'd be very excited about that. Let's look at her incisions. Her earlobe is swollen. That's not uncommon that your earlobe swells. And her sideburn incision is hidden in her hair. Her post-auricular incision behind the ear is hidden in her hair. You don't see the incision back here, so only incision you really see is from here to here, and that's going to heal and just look really good. You really have to hunt to see her sideburn incision up there. That's hidden in the hair. This incision back here is hidden in the hair. This incision is hidden behind the ear, and you do see this incision at first, but you won't see it in a couple of weeks. And again, her earlobe is swollen. That'll go down to about half that size. So I'm very pleased with my surgery and the way she's taken care of it. So facelift surgery, or cosmetic facial surgery in general, especially if you're doing, we did eyelids, we did lower lid laser, cheek implants, comprehensive facelift. It's not wine and roses, okay? You know, people know that they're having surgery, they're going to have swelling, they're going to have discomfort, but I don't think it's as bad as most people think it is. And she's an exceptional patient, and I just tell you something, it's my honor to be your surgeon. Thank you so much.
Thank you, Dr.
Appreciate it. This is Dr. Joe and Niamtu. LoveThatFace.com. All right, how time flies when you're having fun. Here we are with my buddy. She is 6 days out of surgery. Let's take those fancy designer glasses off there a second. And close your eyes here. We did upper eyelids, lower lid CO2 laser resurfacing, cheek implants, periorbital resurfacing, and comprehensive face and neck lift. So that was 6 days ago. Tell us a little bit about it.
Well, every single thing has been going according to plan, and that's been so helpful because all of the ways that you prepared me as a patient in pre-op visits and with the written material, having gone through that.
And the videos. Don't forget my videos.
For sure, the videos. Having gone through that before, now that I've been experiencing all of the things that you all prepared me for, I have no questions like, oh, they said that, they told me this, they told me this. And the videos have been helpful for me these last few days because I can see the progress. I can see that everything that I might have questions about as I'm going along, everything is sort of covered. And that's been really, really helpful for me. No surprises. I've been prepared is what I feel like.
Very good. And, you know, I can't stress this enough that the people that do the best are exactly that. The people that are prepared, they're motivated. She's not walking around in her pajamas 6 days later. And it's that, you know, you may do a facelift once in your life, and doing the research on it, and I even get a lot of people that say, hey doc, I looked at all your videos and I had surgery in wherever, California, and your videos were so helpful. I wish my surgeon would have told me the information you did. I should say, well, why didn't you come to Richmond? But kidding aside, it's great. So what we're gonna do is we're gonna come here in a second and we're gonna take a look at how she's healing at day 6. So here we are at 6 days, and that's our little platysma plasty incision. That will heal. You won't see it. You can see where we've done our periorbital laser, and that's going to really help her lip lines, and she's healing well from the laser under her eye. Here's her upper eyelid incision, and it won't be too long here where you won't be able to see that. Her facelift incisions are healing well. Remember, I have her hair, her incision hidden within her hairline. So I don't make that incision way down here when you could see it. I hide it in the hairline. And then her back incision is also, you only see that part right there, and the rest is hidden in the hairline. And that's very important. This will heal tremendously. And then she has an incision back here. Her earlobe's still a little swollen, but that all looks good. And the one on the other side, we'll show you in a second. And I only use dissolvable stitches, so none of these stitches are going to have to come out. So remember, hidden in the hairline, the sideburn incision, back incision, hidden in the hairline, front incision, that's going to heal great. If we were to look at her in 6 weeks, it would be pretty hard to see. So this is somebody 6 days out of facelift, and this is another day at work for us, and we'll be back in a second. So everybody knows what people look like with a facelift. 3 months later, I have 9,000 pictures on my website. But I think this little series that I'm doing is to try and show people what they look like in the beginning, because that kind of is what scares most people. And if all my patients could be just as good as you and have such a good attitude and prepared so much, things would be much easier.
Well, that's thanks to you, Dr. Niamtu, and to your staff, honestly. Really, you guys are an amazing team, and you really take care of things on the front, so we feel like we're taken care of in the process.
Well, thank you so much. And you know, I have the greatest staff in the world, and they keep me going for sure. So thanks so much. I'm Dr. Joe Niamtu, LoveThatFace.com. Okay, so how time flies. As you can tell, we are in the midst of the COVID situation here. This, we're just out of quarantine and back seeing patients. So we talked to my buddy here 2 months ago, and she had comprehensive face and neck lift, large cheek implants, and upper blepharoplasty, and perioral laser. I want to take your glasses off a second, and you can look at the camera. So, how'd it go?
Smooth as silk. I had zero surprises. You guys, I don't know how you could have prepared me any better. I had everything that happened in my post-op at home with my recovery. Nothing was a surprise because of all the material that you had provided me with previous, and that really, really helped.
Awesome.
Really helped.
Awesome. You put your glasses back on. I
Okay.
like them. So all the positive things she said, she's reading those on a cue card? No,
No.
I'm so kidding. I'm not. She's, again, I've said it so many times. It's just, I'm so lucky to have such great patients. And I find that attitude makes such a difference. And I also find it weird that I'm doing a video wearing a face mask, right? But she's doing real well. You can see that she has a little bit of hyperpigmentation here from the laser. She did me a huge favor today. She came in without makeup, and asking a female to do that, that's asking a lot, and she's so kind to do that. But I didn't want to show you somebody in the previous video, and then today they're all made up and lipstick and everything. So thank you so much, and
Absolutely.
I hope you stay safe. I hope you all stay safe. I'm Dr. Joe Niamtu, LoveThatFace.com. Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and I know you've heard me say this a bunch of times, but the big part of having really good results with facelift surgery is having really good patients. And I'm just so lucky, I'm so fortunate that I get to come to work and do what I love, which is facelift surgery, and I just have the greatest patients. And so here we are. We are 8 days out of upper eyelids, lower eyelid, lower lid laser, and face and neck lift. And she just looks super. When I walked in to see her at her 1 week appointment, I thought I was in the wrong room. So, how's it been?
No. Easy.
Talk a little loud there.
Very easy. Shockingly easy.
Have you been in a lot of discomfort?
No.
Okay.
No.
Okay. What do you think was the hardest thing? I know you mentioned to me that sleeping upright was a little difficult, you said.
Yes, sleeping upright was difficult, but I was not expecting so much discomfort in the neck area, but I guess anticipating and knowing what to expect is the biggest aspect of it.
Right.
But I guess I over-expected more discomfort.
Right.
And when you come out of surgery and you see, the big swelled face, and you expect that.
Right.
And your first week of surgery, you expect so much trauma and swelling and bruising. I didn't have all of that. And I didn't take hardly any pain medication whatsoever.
Wow, you must have a good doctor. No, and the situation is, and I always explain this too, there's so much variability with post-operative healing. And some people, not very often, but every once in a while it knocks the wind out of somebody's sails. But most people do quite well, and then some people do really great. And, I'm just so fortunate to be able to have good patients. So here we are at 8 days, and you can see that we still have a couple sutures that haven't dissolved. This is not my incision. That was somebody took off a mole in the past and didn't do too well with it. But it used to be way down here. Now we've pulled it up. But again, if you notice, all of my incisions are hidden in the hairline. You really can't see that incision. And then this incision's hidden in the hairline. So in another couple weeks, you won't even be able to see those. Let's take a peek at the other side. So again, you can see we still have a couple sutures present. But when you look at facelift, you want to have normal earlobes. You don't want to have pulled down earlobes. You want to have a normal tragus, which she does. And I make my incision very specifically here, and I do it in front of the ear. But you mark my word, you'll look at her later, and you won't even be able to see it. The sideburn incision is hidden in her hairline, so you don't see that. And the incision behind her ear is in her hairline, so you really don't see that. So it's important that patients have incisions so you don't have to change their hairline. So again, facelift surgery is my passion. It's my life work. I've got a great office. I've got a great staff, and I'm so fortunate to have great patients. It was really my honor to be your surgeon, and I'm so excited to help people look and feel younger. I'm Dr. Joe Niamtu, LoveThatFace.com. So here we are, 2 weeks after upper lids, lower lid chemical peel, comprehensive face and neck lift, and buccal fat reduction. And the thing about recovery is it's variable, but there's kind of a standard, and we like to tell people that the initial recovery is about 2 weeks. So here we are, one of our favorite patients, and she's 2 weeks out of surgery. And you know, I think she looks really good. She looks better than some patients at 2 weeks, but this is you know, this is what we aim for, this kind of situation. How was your experience so far?
So far, I'm amazed that the most discomfort was the first 2 days, and after the third day, started to feel pretty good. And after a week, my husband had to slow me down because I felt good. And after 2 weeks, I'm feeling very good. So the first 2 days was uncomfortable, but.
And you expected that?
Yes.
Now, of course, this is not her final result. We're not even going to take her after pictures for 90 days. And she still has swelling. And we'll show you in a minute. We'll look at her incisions. But she's just doing great. And this is what makes me feel so good when we have compliant patients. They follow their instructions. They take care of their wounds. They eat well. They don't overdo it. And it's just... It makes everything come together. You're a great patient. We'll take a look in a second at her scars. So my staff and I take a lot of pride in our facelift incisions because, after all, that's the surgeon's signature. It's their face, it's my reputation. So I'm going to show you what we do. First of all, the sideburn incision is hidden in the hairline. And the posterior incision is also hidden in the hairline. Actually, you can see a little bit of it because she has her hair pulled up. But basically, when you look behind her ear here, you don't see anything. We take a lot of care to place these as best we can within the hairline so patients can still wear their hair up. You can see our incision in front of the ear. In probably the next month, you won't be able to see that. And the other incision is hidden behind the ear. So same thing, our incision is hidden within the hairline, so you won't see it. A lot of people make their incision at the bottom of the hair, but then you see it, so we always try and camouflage it. Same thing back here. This incision goes back here, and you won't see it. Same thing, a lot of people, if the camera moves back here a little bit, a lot of people make their incision very low like that, and I don't like that. I don't agree with that because you can see it. This incision is hidden. So she's a great patient. We really look forward to looking at her 3-month follow-up. So the take-home here is to have great results. You have to have a good surgeon, you have to have a great staff, and you have to have a great patient. I love what I do. I'm so fortunate to be able to get to come to work and do this kind of stuff with these kind of people. I'm Dr. Joe Niamtu, LoveThatFace.com. Hi, I'm Dr. Joe Niamtu, LoveThatFace.com. I know I keep saying that, and welcome to our little series here about post-op facelift recovery. So, another out-of-town patient, again, my honor, and we are 2 days, 48 hours after comprehensive facelift with platysmoplasty and smastectomy, bilateral lower lid, transconjunctival blepharoplasty, and periorbital and perioral laser resurfacing, and that's why all that looks so brown is the laser. So Here we are at 2 days. How we doing?
Good, very good.
All right. So your first night, I know you had some discomfort in your one eye.
Yeah, but it, it slowly got better, and Dr. Niamtu was very helpful in that respect. So
I made a house call.
You did?
Make sure you were okay.
Yep, and I'm feeling good. There's a little bit of tightness in the neck, but that was all explained to me in the videos, the very educational videos that are on his website. So
here we are now, second day. What are you feeling? How do you feel?
I feel great. I mean, there's minimal pain, and I'm on my somewhat liquid diet in order to make things easier for myself, and doing fine.
Great,
Feel
great.
good.
And I keep explaining that I don't want anybody to think, well, he's only taking the patients that do well, because occasionally there's people that have a harder time with it. But in my experience, people that are upbeat, that really have studied the procedure and know what to expect and understand that, and people that are have positive attitudes do real well with this. Now, you get some people, as we know, there's always people out there that just hate, they have white coat syndrome, they hate surgery, doctor's offices, needles and everything, and it may be a little tougher for them, but I'm sure glad you're doing well. And another thing I keep saying is part of having great results is having great patients. I'm Dr. Joe Niamtu, LoveThatFace.com. So we're going to take a look at her incisions. Again, I hide all my incisions in the hairline, so you really can't see them. They're disguised. Some people put them below the hairline. The problem with that is that sometimes they get white and they become very obvious. My back incision, again, is hidden in the hairline, so you're not going to see that. And the front incision will heal very good. She has a couple little lumps and bumps right here, and those will smooth down as she heals. So same thing, you can't see her incision, but it's up here in the hairline. So that's not going to affect. One of the problems that some doctors make these incisions low, and when they pull the skin up, they take away that hair, and it looks terrible. Same thing with my posterior incision. You have to really spread her hair to see that. She has some staples in there. On out-of-town patients, I don't use staples because then they'd have to get them out. So everything is looking good here. And her submental incision, so we did a platysmoplasty, cut out some of the muscle where those bands were, put it together for a nice tight neck, did liposuction here, and that neck's going to look like it did when she was in high school. It's going to look really good. And then we're doing a new thing here where we're not using sutures and just some steri strips and a special adhesive, and that heals well too. And again, you can see where we have lasered here. She's going to just keep that greasy for the next week, and then that'll be healed. I'm Dr. Joe Niamtu, LoveThatFace.com. Okay, hi, Dr. Joe Niamtu. We're back. Now, we talked to my buddy here the day after her surgery, and she was doing super. Here we are 7 days later. If you remember, we did comprehensive face and neck lift with platysmoplasty and my C-smastectomy, and we did her lower eyelids, lower lid blepharoplasty by the transconjunctival approach, and we did lower lid laser and laser around her mouth. So here we are, 1 week later. How are we doing?
Doing fine, feeling good. No problems whatsoever.
Okay. So I mean, your recovery. What can you do? What can't you do?
I'm relaxing. I'm watching TV, taking a nap whenever I want to. Of course, no lifting, no bending forward. Drinking, making sure I'm taking plenty of fluids in, and protein that my body needs to heal.
Well, that's awesome, and that she's doing it perfectly. And I always tell patients too. I have a special video on what I call tech neck. We don't want people to be bending down, looking at their devices, doing whatever they're doing in this position, because it can cause little folds of swelling that can last for a while. So anyhow, you're doing so great. Thank you so much for allowing people to look in. We're going to come and look at your incisions here in a second. So if you wondered what our incisions look like at 1 week, you can see again, remember I hide my incisions in the hairline. So that's the hairline incision. You can't see it. The back incision here, we have some staples and some dissolvable stitches, but again, that's all hidden in the hairline. And because of her laser, she has a lot of grease, a lot of Vaseline on here, so some is in her hair, but that's hidden. And then her front incision here looks good. You know, she has some swelling in the neck around the muscle, and that's not unusual. That'll go down. And then we have some bruising, but she's looking pretty good. We'll go look at the other side. So, hidden incision in the hair. Then there's the incision behind the ear, the incision in front of the ear. And these sutures are dissolvable, so I can actually just pull some of them out. If you look at this in 8 weeks, you won't even be able to see that incision. Some bruising, a little bit of neck swelling right here, not unusual for 1 week, and that'll all go down. So she is just doing great. Thank you for watching. So in our series, here we are, and here's a patient that's 2 weeks out. She's done really well, and these are all consecutive patients that I'm showing here. These aren't patients that we just picked out. They are consecutive that we've done over the last several weeks. So at 2 weeks, tell us about your experience.
It's been great. Everything's gone very smoothly. I've been very happy. Of course, there's still some numbness and tightness I'm experiencing. It's been good overall.
And she's done well. She's taken care, you know, the patients that follow instructions and take good care of everything, they can make a huge difference. So, you know, you kind of have three variables. You have the doctor, their skill, you have the patient, their compliance, and then you have this thing called Mother Nature that sometimes doesn't cooperate. So we'll take a look at her incisions, and just, you're doing really well. I'm proud of you. Thank you.
You're welcome.
All right, so at 2 weeks, she's really healing well. I mean, she's got a little scabbing here. Again, this incision's hidden in the sideburn. This incision's hidden in her hairline behind her ear. And her earlobe's still swollen, and she's still, she has what I call jello. You can see how the tissue bounces here. So all that swelling is going to go down. We'll look at the other side here. So again, she's healing nicely. I think in another couple weeks, you're not even going to see that incision. And this incision's hidden in the hairline. This incision is hidden in the hairline. This is the only part that's visible right there and right there. And again, I make my incisions in front of the tragus. And the way I do it is I get the best healing that I've ever had over decades. And I never distort this tragus, which is so important. So again, the earlobe is a little swollen, as you'd expect. And we have a little jello here. So she has maybe a tad more swelling at 2 weeks than some people, but looks really good. So thank you very much for watching this video. I know it was long. And if you follow my channel, you know that I have hundreds of videos with hundreds, if not thousands, of before and after pictures. So if you want to see before and after facelift pictures, go to lovethatface.com and look at the facelift gallery. I think that the biggest thing I wanted to do in this video was to show how people did, how they looked, how they felt, how they talked, how they dressed immediately after surgery. And it gives you an idea of what to expect from recovery. So I'm Dr. Joe Niamtu. I am in Richmond, Virginia. I only do cosmetic facial surgery of the head and neck. I did 109 facelifts last year. It is my passion. We see patients from all over the world. And thank you so much for your gift of time in watching this video.